Thank you. So on behalf of my colleague Kelly and Francois Demeg, who is leading the big data strategy, big data steering group activities, I will take you through the slides, and then both of them will feel free to jump in if I forget something or if they want to give more precision. So if we can move on the next slide. So as just mentioned, what we're going to present to you is mainly focusing on patient experience data. And this is because although we know the value of patient experience data, this is a type of data that is not yet systematically included in all areas of medicine development and regulation. And it has been mentioned or put as a key priority area for the regulatory network strategy, but also for the regulatory science strategy. And the idea is that we work on implementing a number of activities to increase and put forward the use of these data, not only for the regulatory area, but also downstream stakeholder decision making, such as health technology assessment and value assessment or payers assessment. And there is already some work ongoing on this topic to harmonize the vocabulary and the methodology. So there is some work being done at ICH level, and we want to tap into these activities also to increase and drive what we are doing. Next slide, please. So in terms of continuous dialogue on patient experience data, this it's not a recent activity. It started way back in 2022 when there was a workshop with different stakeholders, including patient and healthcare providers. And this was about driving a common understanding of what patient experience data is and the challenges of using this data, including methodologies for collecting and analyzing and incorporating this data in regulatory assessments and decision making. So it was also about understanding how patient data can be collected through real-world healthcare activities, and it can be part of real-world data and used, analyzed to generate real-world evidence. Then following that workshop, a more focused meeting took place earlier this year with a selected number of patient representative and patient organizations representative to try and work a little bit more in details and brainstorm around the activities to be put in place. And some of those activities are part of the work plan that we will be presenting to you now. Next slide, please. So this has then led to the big data steering group work plan focusing on patient experience data in terms of three main priorities. And this is about understanding and increasing the transparency on the current use of patient experience data in the regulatory context to support evaluations and decision making, identifying the challenges and the opportunities for enhancing a more optimal and impactful use of these data, and establishing their value. And establishing their value through regular usage and adoption of these data, and this being done not only in the regulatory decision-making setting, as I mentioned, but also beyond that through the collaboration with patient and healthcare professional and other stakeholders. Next slide. And just to mention that this plan is also has then been included in the bigger patient experience data work plan. There is a community that has been set up in the agency, and so these activities are conducted or driven by a big data strategy group, but within the context of this bigger patient experience data community. So the next two slides are just to reflect on some of these key activities that are related to patient and consumer organization, but also healthcare professionals. So if you remember the 11 recommendations of the big data strategy, we have for some of those highlighted key activities and key actions that have been selected. So when we look into the governance framework, for example, the key action is to make sure the patient and healthcare professional voice is always represented. And this is why we have Iona and Georgia, for example, earlier on, who were mentioning what they play as a role in those activities and in those meetings, and making sure that the voice of patient organizations and healthcare professionals is well represented. So this engagement in terms of status is ongoing and has been renewed. The mandate has been renewed as part of the governance framework. On the data discoverability, we have put forward the idea of making sure that patient organizations and healthcare professionals contribute to mapping existing data sources where we can actually identify patient experience data, for example, that is being collected. And then there is a lot of an ongoing work on putting together a reflection paper on patient experience data. And this work will start and will be ongoing, and patient organization and healthcare professionals will be consulted and will have a chance to provide input through the public consultation. So, and then we move into data quality and representativeness recommendation. And here there are three key actions. So contribution of patient organization and healthcare professionals on the data quality framework. And I think this was also mentioned earlier on by Yona and Georg. Contribution in the qualification of novel methodologies. So there was a workshop earlier this year to around early summer, and this workshop has generated a report, and this report will be further discussed with patient and consumer organization and healthcare professionals. And then there will be early next year a workshop on the use of registries in the regulatory setting, and this workshop will have patient experience data at the core of the activities, and patient organizations and healthcare professionals will also be consulted and perhaps contribute also to the workshop. This activity is actually mainly led by my colleague Kelly. So if there are some specific questions, she's happy to provide them. And I don't know, Kelly, if you want to step in here, I can pause if you want to give some additional information.
Yeah, thanks, Denise. Good afternoon, colleagues. I hope you can hear me correctly because I've had problems with my earphone. It's okay. Yeah, great. So yeah, like Denise said, we are starting to organize this workshop that will take place on the 12th and 13th of February next year. And we are currently looking at all the topics, the scientific content, basically, of the workshop. So, and I believe I came in June to give a little update on this topic, registry topic. So if any of you are interested in, working with me on the scientific content, just to make sure that the PED topic is correctly included and considered in this workshop, just feel free to contact me and I'll be really happy to work with you. Thank you.
Thank you. So we can move on the next slide then. Okay, so for the remaining two recommendations, so the EU network skills and the EU network processes, we also have some key activities. So I think Georg mentioned earlier on that there is a plan on listening to the voice of patient organization and healthcare professionals by running a survey, for example, on training. So as part of increasing EU network skills, the idea is to develop some trainings, for example, on big data, on pharmacoepidemiology concept, on data analytics, and these trainings will be also offered to patient and healthcare organizations. But we will, prior to doing that, we will run a survey to understand the needs and to be able to tailor a little bit more the content to those organizations. I think there was a question earlier on as to giving listening to patients' voice in around the usage of their data. So we hope that these activities will contribute in that sense as well. On EU network processes, the big activity there is to actually enable and establish the value, enable the use and establish the value of patient experience data by running a proof of concept study that will demonstrate the added value of considering patient experience data as part of regulatory assessment. And for that, we first of all want to look into what has been done so far. So we're doing a landscape analysis of different initiatives that aim at strengthening the use of patient experience data. And then we will look into the challenges and opportunities when it comes to the usage of that data. And based on that, we will develop then a proof of concept study designed to address some of these key limitations. And this is a big undertaking because it's not easy to just come up with a research question and design a study. So to be able to do that, we actually really in direct consultation with patients, and I will talk about in a few minutes a meeting we recently had with patient representative to discuss and brainstorm and then design together the research questions that we might take forward into this proof of concept. Next slide, please. So this is where we are now in terms of building activities that aim at establishing the value of patient experience data. So in the very short term, we are now, we had in July a meeting with a selected number of patient representatives to brainstorm around gaps in the regulatory assessments where we could immediately plug patient experience data and add value to the decision-making process. And so we are trying to identify research questions, and we actually now in the phase where we are waiting for patient organizations to come back with some ideas and suggestions. Then we can design this research question and the study next year. This study will most likely go through one of the pathways that the agency has to generating real-world evidence. It's what we call framework contract. So we go through some research organizations, and they support us in conducting the study and gathering the data that we need. And so we'll be working on that as a priority end of this year, beginning of next year. And then in the midterm, so this is where we will continue this landscape analysis. We ran a literature review to look into the usage of patient experience data in the non-interventional setting. And then we will have a number of topics that were also already highlighted a little bit in June in this forum as to how findable, acceptable, interoperable, and reusable, so that's the abbreviation we see there, FAIR, patient experience data are, and how ready they are to be used. And this is where we will address some of the challenges of data harmonization and data interoperability that have been highlighted already back in June. And we will try to work with experts in those fields to come up with some solutions. We also hope to be able to leverage the new data source catalog once it's published to make sure that we capture information around patient experience data, what type of data sources already collect relevant patient experience data, what is the quality of this data, and all of this in an attempt to really increase visibility and discoverability of this data, but also the quality of it. And in the long term, we actually want to take these activities in a broader scope and come up with a kind of a program of initiatives that involve more stakeholders than this forum or the regulatory network, but also beyond the regulatory setting, health technology assessment and payers, for example, to have an EU-wide program of studies that aim at establishing the value of patient experience data. Next slide, please. So just to summarize and conclude with a few next steps. So we are working immediately now on the proof of concept where we are waiting for input from patient organizations. The deadline is end of this month. And if there are colleagues here who wish to contribute or have some ideas that they want to propose, please feel free to reach out. And then we will work on a full proposal of this project end of this year, early next year, and we hope to design, contract, and launch the study in 2024. We're also working, as you saw earlier, on a number of scientific publications that will come out of the landscape analysis, for example, and all different initiatives that we, insights, sorry, that we come across. And for that, we will have additional support from collaborative experts who will start in October 2023. And then just to highlight a few upcoming big data steering group events that might be of interest for colleagues here. So there is an artificial intelligence workshop on the 20th and the 21st of November, and a multi-stakeholder big data forum on the 4th of December. And all of these will also be there will be more communication around this in the coming days, but just to give you some heads up. And I think this is the end of it. Unless Francois and Kelly, you want to add something else, and then we might discuss more in the Q&A session. Thank you very much.
Thanks, Denise. Nothing to add from me.